Well, this afternoon, the Ashanti Regional Security Council says it will deploy security personnel to ensure strict compliance with the coronavirus safety protocols. The decision comes after the region recorded 304 deaths from the coronavirus pandemic. Addressing the media today, the regional minister, who doubles as chairman of the Regional Security Council, Simon Osei-Mensah, said the council will deploy security personnel to ensure strict compliance with the COVID-19 safety protocols.
With the onset of the new variant, that's the Delta variant, Ashanti region has seen a very sharp upsurge in the number of cases. Because of this, it has become necessary to tighten the enforcement of the various COVID protocols within the region. And the security agencies are going to ensure that we abide by or we observe all the COVID protocols. We are urging all the metropolitan, municipal, and district chief executives to join hands with the respective security councils to undertake the following. 1. Ensure mandatory wearing of face masks in all communities. 2. Provide Veronica buckets at public places, including markets, lorry parks, and health centers. Make public announcements to increase awareness of the new wave and the need to enforce the protocols. And also, enforce all restrictions on public gatherings as spelled out in the President's 26th address to the nation on the COVID situation. With regard to public transport, drivers are to ensure that everyone who boards their vehicle has the face mask on. In the event where the security agencies meet a commercial vehicle and a passenger is not masked, all the other passengers will be asked to alight, and the driver, the passenger who is not wearing the mask, together with the mate, will be taken to the police station for the law to take its course. Wherever you will be moving in this region, please, we urge everybody to put on the face mask. And we wish to inform the general public that the security agencies will be deployed all over the region to ensure enforcement of all the COVID-19 protocols.
Let's find out how the region intends to carry out this revised directive. And joining me via Zoom for the conversation is Dr. Roxanne Michael Ejay. He's Deputy Ashanti Regional Director of Public Health. I'm grateful for your time. Later, we'll also be joined by virologist Michael Owusu from the KCCR and also a lecturer at KNUST. Let me start with you, Dr. Ejay. How differently are these measures going to be enforced?
Thank you very much, and good afternoon to your viewers. As the minister said, we have gone on the road of preaching the protocols for people to adhere, but we've gotten to a stage whereby adherence is actually not forthcoming as we expect from the input we have made with our communication. So I think the security coming on board to ensure that people adhere is in the right step, and we are in full support of it.
Now, the region has 1,253 cases. How do you intend to slow the infections?
Yes. Where we are now, it is until people understand and until the steps that the minister just outlined have been fully enforced, we may not see a downward trend in the cases. And for when adherence starts today, we are assured of seeing the results in 2 weeks' time, looking at the incubation period of the virus. So that is our trump card. Our first defense is to ensure that the protocols are observed. Infection transmission is interrupted by all the things we've been preaching about, wearing our mask, and then also ensuring that we don't crowd up or we don't gather in places that will cause spread of infection. So as these measures are being enforced, then we are sure that we can get some results by way of seeing the numbers come down in the next 2 weeks.
Doc, we're all getting worried because we are told that our communities have been taken over by the Delta strain. Now, what is the nature of the enforcement and its associated punitive measures that you talk about in your region?
Well, for enforcement, it's really in the bosom of the security. For us, the health experts, we only advocate and advise what needs to be done. But I think the minister was very clear in his actions or in his outline that in Trotro, if someone is not wearing the mask, the entire passenger or the entire passenger body would have to suffer for it, in that they may have to get down wherever they are for punitive actions to be applied to the one who was not wearing the mask and the driver. So I think these are good, and we'll test how it goes in the weeks ahead.
Dr. Roxanne Michael J. He is the Deputy Ashanti Regional Health Director.